Hey, hello, ladies. How is everyone doing tonight? Welcome from the Sawtooth Mountains in Idaho. Uh, camping out here in the beautiful central mountains in Idaho. Uh, I hope you enjoy our session tonight. We're going to uh, talk about your questions again. We're going to answer some questions. So, welcome to Wellness Wednesday, and I hope you all are having a great week so far. I had so many questions during the master class that I didn't get to answer them all, and I'm going to focus on several questions tonight uh, that have to do with thyroid. So you had a lot of great questions, but before I dive in, and while we get everybody on the feed that wants to participate tonight, and I also did get some questions in the group, so that I'll answer a few of those as well. I do need to say my disclaimer. So this is not intended to be any more than health information. So it's not health advice, what you hear during tonight's Wellness Wednesday. And please do not start taking, or change the way you're taking any of your medications. If you think you need to, please consult first with your prescribing practitioner so they can help you do that. And lastly, by attending tonight's Wellness Wednesday, this does not establish a doctor-patient relationship. So there you go. All right. It's a pleasure to be with you all again tonight for this Wellness Wednesday in the middle of the mountains of Idaho. So it's kind of fun. Keep in mind, we've had thunderstorms all day while we've been here, and I'm hoping that our connection. Just pray that our connection is okay, and that we'll be able to continue on and spend about 25, 30 minutes answering your questions from the masterclass. So here we go. Now, I'm going to talk about some questions about nodules. So some of these questions, Laura asks, what are nodules on the thyroid? And Sharon asks, does he or me recommend to biopsy nodules? Okay. And she gave some sizes that she, I guess, had. Hannah asks, can nodules on the thyroid get smaller, or do they turn into cancer? Tabitha asks, does this plan treat or get rid of nodules? Okay. Patty asks, but if you have nodules, that means you have Hashimoto's, right? And Denise asks, are thyroid nodules normal for people to get, or swollen thyroid gland? And what causes them? Do they turn to cancer later? So several related questions. And I'm going to start just by saying that nodules are your thyroid's way of dealing with several things, especially an autoimmune attack on the thyroid gland. So this is typically due to Hashimoto's, or it could be due to Graves'. All right. So thyroid nodules are overactivity, walled off activity, where the thyroid parts of the thyroid gland are targeted by the immune system. All right. And yes, they are the precursors to thyroid cancer in most cases. No, they're not always the precursor to goiters, which is swelling of the thyroid, kind of diffuse swelling or overall swelling of the thyroid. So yes, if you have that, that's a different, it's a different problem. And generally, that's related to an iodine deficiency, but not always. Okay, so I have some other questions about iodine. So thyroid nodules, depending on the size, yes, they probably should be biopsied. You probably do need to see if you're developing a thyroid cancer. Some facts about thyroid nodules. If you have a solitary nodule, this is more likely to be a thyroid cancer than if you have multiple thyroid nodules. Multiple thyroid nodules generally indicate Hashimoto's. Okay. And I have treated a lot of Hashimoto's, and many of those have had thyroid nodules that have decreased in size, all right, or in number. So yes, if you are able to become a patient, and we take you through a customized care plan, a program, The typical result is that the nodules either shrink or decrease in number. Generally above 1 centimeter, I believe, and I'm kind of out of away from that aspect of care because I no longer do primary care. However, if you have had nodules ultrasounded or scanned in the past, and you've been recommended to get rescanned every so often, then yes, I would have them scanned and monitored. Sometimes they do need biopsy depending on the size. So yes, I am in favor of checking them out, whether it's through a scan, and certainly biopsies are the definitive way to determine if you have a thyroid cancer or not. So, okay, moving on to your next question. So, Noni asks, is it ever too late to reactivate the thyroid properly? I've been diagnosed with hypothyroidism and Hashimoto's and treated with traditional medications for over 20 years. The problem with Hashimoto's is that it causes a decrease in thyroid function because it literally destroys the thyroid bit by bit. All right, cell by cell. So you're never going to regain those cells' function. And because every cell in your body needs thyroid to function, chances are that what's happening with your thyroid cells, you can keep them functioning, but you're probably not going to reactivate cells that have died. All right, that's not how it works. Once they're gone, they're gone. And I just spoke with a woman yesterday, and one a few weeks ago as well, who had her thyroid ultrasound done, and the comment by the technician with this lady I spoke with the other day was that her thyroid gland was unusually small. And then the one that I spoke with a few weeks ago said that her thyroid gland had all but shriveled up, and she knew that means that it had shrunk, because previous ultrasounds, that was not the case. So what happens with Hashimoto's is the immune system attacks and destroys the thyroid when it's triggered. So it's going to destroy and kill parts of the thyroid bit by bit, or cells bit by bit, and you will lose that function. And some of these other questions then need to be answered. So since the removal of thyroid, I wonder, and this is Jennifer is asking this, I should be taken off some meds to see if they are necessary. No, I don't agree with just stopping the medication just to stop it. You've got to have something in place. You've got to be figuring this out. Your thyroid gland, yeah, if it's gone, you're not producing certain hormones, certain carrier proteins for those hormones either, and you're going to be plumb out of luck if you just stop the thyroid replacement. And most of you who attended the masterclass and asked these questions do this for a reason. You ask for a reason, and you're here for a reason, which is you're struggling. You're having symptoms despite taking the medication, and I get that. But there are many other reasons why, after removing the thyroid or ablating the thyroid gland for its, inefficacy, it doesn't work. So there are many other factors. You shouldn't just stop it. Then you're going to be in an even deeper world of hurt, and less of your cells are going to be functioning as a result. So I never recommend just stopping it. Furthermore, if you have Hashimoto, more and more, and destroying even more of the thyroid gland. Okay. I'm being told that my connection is unstable, so we're going to press on. Hopefully, we will be okay. So, can one cure hypothyroidism? Asks Star. So, the answer to that is, well, we don't talk about curing, okay? Because again, once the thyroid gland is, missing cells, let's put it that way, it's shrinking or missing cells, or the nodules that are developing are not producing and releasing thyroid hormone, then uh, we're not talking about curing. We're talking about balancing, putting it into remission if we're talking about Hashimoto's or the autoimmune problem, which is the cause 95 to 98% of the time, if I can remind you. So if we are really being honest, it's not we're not talking about curing. We're talking about balancing appropriately. So there's a mosquito, lots of mosquitoes. All right. Since I don't have an active thyroid and rely on medication, asks Sally, does eating or taking supplements really do anything for me since my thyroid is inactive? And I would say absolutely. In fact, most people with a thyroid issue have issues with their thyroids because you're missing nutrients, because you're not eating right, because you're missing the building blocks for functioning better with the thyroid. So building blocks come from eating the right foods. You're too toxic from eating the wrong foods, and because of genetics. And I explained a lot about that in the masterclass, showing that most of you have genetics that make you susceptible to biotoxins, right? Biotoxins are created by living organisms, and if you're susceptible, your immune system cannot clear these toxins out, and they're going to keep causing inflammation and cellular damage. The toxic burden causes your body to go into protective, like a self-protective mode. And because of with energy production, the exhaust or the waste becomes too much for your cells to handle. You start developing insulin resistance, and then diabetes, which is so common, the most common disease I see in postmenopausal women with hypothyroidism. So it's really important that you do take the right supplements, and you've got to get comprehensive testing to figure out which ones you need. You've got to get comprehensive testing to figure out where the imbalances are and what you need to focus on from a holistic, natural perspective, because medicines are not there to help you. We're not dealing with diseases. You've got to have the right nutrition and the building blocks, or you're going to continue to suffer with poor energy and poor sleep and hair falling out and weight gain and inability to release fat. So important that we take care of this issue the right way. Angel asks, is remission a possibility even if I've been on meds for 25 to 30 years? Yes. What? I have 80-year-olds who have beat this, who have put this into remission, who have turned things around, released so much weight, got their energy back, are playing with their grandkids again. It's absolutely possible. You've just never had the opportunity, never been given the opportunity. So comprehensive testing for the causes and how this, needs to play out for you, the blueprint that I gave you guys to follow, really is vital. I mean, it's absolutely necessary for you to solve these problems. All right, so Jeannie asks, what about taking Lugol's solution, 1 drop a day for your thyroid? My grandmother swore by it. Okay, so Lugol's is a preparation for iodine, and it's a good preparation. It's in the right form. It's also carried by what we call fulvic and humic acids, carbon-based uh, material based on from carbon material that's active, that's from decaying matter, animal and plant matter in the ground that contains active carbons. Okay, so this technology is awesome, and it's in a lot of the supplements we use, apart from Lugol's iodine. So that is one product, but there are so many other products that are produced with this with these, and these are not my products. These are I don't have any personal financial stake in any of these products. I just spend a lot of money on them and help my patients take them. Um, it's they're extremely helpful because of this active carbon component, which acts as a vehicle to get the iodine into your tissues properly, so that it is more useful and usable by your thyroid. So it can be very helpful for many. Not everybody needs extra iodine. So it's not just a blanket, yeah, you should take it. No, it's not that simple. And if you need it, it's great and it really helps. Okay. And some of it can be done trial and error, but I uh, I just recommend going through the right process to see if, you know, uh, you know, let's take a good history and see if that's something that you need to utilize in your process. It all needs to be a customized process. When I gave you the blueprint, and step 4 is you need a customized care plan to help you with the deal with the comprehensive diagnosis to help you reach your goals. This is part of it. Okay. Shannon asks, and this is a good question, is there a way to reduce all antibodies to 0? Reducing antibodies to 0 is not typically our goal for therapy. And the reason is I've seen it both ways. Meaning, I have seen the amazing improvement in these symptoms and in reversing the symptoms caused by Hashimoto's and hypothyroidism, regardless of lowering these antibodies to 0. In fact, sometimes they go up. And this mainly has to do with your tissues releasing these hormones, these antibodies, and they're building up in your blood because they're no longer taking an active role in the tissues. So what is in the blood really doesn't tell us what is in your tissues and how it less than 1.0 for thyroglobulin antibodies, which doesn't tell us that they're 0, but it doesn't tell us that you don't have them, either. So that's not the goal. Reducing antibodies is not the goal. All right. Many of you would be so disappointed, even if you're feeling better, to learn that your antibodies are increasing. So just had a patient I reviewed things with yesterday, and that was the case with her. She's doing much better. Her symptoms are so even now, reduced drastically, and she's much more even. And typically with Hashimoto's, you're on this roller coaster of symptoms where they get bad and then they get better and then they get bad. You never really know when you're going to have a good day or a bad day, and so it's really maddening. You can't plan for anything. I mean, you stop going out with friends because or planning to go out with friends because you just don't know if you're going to have a good day or not, when you just had one. So it's so unpredictable. Well, that's the sign that you're getting this into remission, is that your symptoms lessen and now you're on an even keel. Um, that's what we're looking for. That's really the hallmark of improvement, where you're achieving your goals, whether it's releasing weight to your goal, you're, increasing your energy and stamina, and improving your sleep quality, getting restful sleep, uh, reducing anxiety, getting rid of depression, reducing insulin resistance, and like I said, weight gain. Um, having the symptoms resolve and then staying that way, right? So that's what we want to see. The antibody numbers don't matter. They simply don't matter. So very good. Um, let's see. Um, Myra asks if, okay, I had thyroid removed over 15 years ago. I take Synthroid daily. My numbers are in the normal range, no problems outside of weight gain. I would like to know if I can succeed with weight loss if I follow the doctor's plan, or if it's just for people who still have their thyroid. Myra, absolutely. This is helpful for you with people that don't have their thyroid, who do have their thyroid, who are struggling with these symptoms, because um, it comes down to what are the true causes of your symptoms, and it's not always thyroid. In fact, weight gain, what we talked about in this last masterclass, is that it's mostly insulin resistance that is the problem, dysglycemia to some extent, which is the biggest cause for weight loss resistance, right? So it's not always the thyroid problem. If your temperature's good, you don't have brain fog, and your energy's good, and all you're dealing with is weight gain, let's check things out thoroughly. Like, comprehensive testing will give us those answers. Is it an adrenal issue that's also impacting blood sugar issues, right? We've got to look at all these systems. Is it liver, issues, fatty liver, that has to be corrected, along with insulin resistance and so forth. So we have to get the right information for you. The right information for you is crucial for us understanding how to treat you and how to help you solve your issues. So absolutely, Myra. Okay. Jen asks, this is kind of a long one. I am interested in current research to support those of us who have suppressed TSH that are on treatment when other markers are low, such as T3 and T4, with Hashimoto's. Central hypothyroidism and pituitary issues have been ruled out. I don't really feel like the TSH matters, especially since before diagnosis, I had a low TSH to start. What matters is how I feel, especially if my T3 and T4 are low. What evidence can I bring to my functional provider to help support continuing to treat despite having a suppressed TSH? Provider worried about osteoporosis and regular heartbeat risks like arrhythmias. Okay. The question is really, why is the TSH low? Okay. And if the TSH is low and your thyroid hormones are going to be low and you're hypothyroid, why would that be? And the evidence is that there are so many studies on toxins, biotoxins, that show that neurotoxicity leads to problems with depressed TSH function, along with depressed adrenal stimulation function and ovary stimulation function. So that all comes from the pituitary. And while there may not be a zero level of hormones being produced by the pituitary, which is what they're looking for, like, it's the pituitary is done. It's not producing anything. Is it possible that the pituitary is producing a little? Except that's not their standard for diagnosis. Their standard for diagnosing a pituitary problem is nothing. So just complete suppression. This is the problem. They're taking kind of an all or nothing approach. They're not looking at dysfunctional ranges. Guys, Gals, it's not that simple. We've got to be smart about this. It's like, I don't know. When I was a kid, I drove a car that was a four-cylinder car and it had over 300,000 miles on it. And guess what? A cylinder went out. It still drove. Could it go as fast? No, no. But it drove on three cylinders. It got to the where it was still driving on two cylinders. Okay. It just didn't go very fast. It wouldn't rev up real quick. I mean, you get it up to like 25, 35 miles an hour on most, city roads that you could drive it on, but it still functioned. It's just it wouldn't go as fast. I couldn't go on the highway with it. So it's functional. It's dysfunctional. If you have mold toxicity, this can affect your pituitary gland. If you have Lyme, this can affect the pituitary gland. If you have heavy metal toxicity, mercury toxicity from silver fillings, those vaporize, they go right up into your brain. Ladies, this is huge. So if your toxic burden is high and your immune system is ill-equipped to take out those biotoxins because you're genetically susceptible, could you have subclinical hypopituitarism causing low thyroid? Yes, absolutely. That's a freaking lootly you could. So let's be smart about this. Let's get the right answers and just take a practical approach. All right. Getting the right tests is so important. So, okay, there was another question and just a few minutes left. Couple questions. So I don't have a name on this one. I was just diagnosed with hypothyroidism and was told to come test again to start medication if the test results stay the same. Is there any way I can reverse my hypothyroidism before my next test so that I don't have to take the medication? Well, I get that you don't want to take medication, but if your TSH is high, granted, we definitely need to dig deeper. We need full thyroid panel. We need to know what those other thyroid hormones are. So that's really the answer. Those are the tests that are needed. Right? A full thyroid panel. I told you there are 12 markers. If we do comprehensive testing, we get most of those markers. Very few do you need all 12. But I do test those from time to time in people that actually do need them. That's what this lady needs. And then, is there any way I can reverse my hyperthyroidism? Well, since 95 to 98% of the time, and again, she'd need to be tested for this, it's due to Hashimoto's. So that's not something that you can just reverse. It's something that you have to treat differently by controlling the triggers. You have to identify if that's the central issue, and then it's like spokes of a wheel off that central issue, and you're identifying those issues, those triggers that cause the Hashimoto's to flare. That's the key. It's taking care of all of those triggers all at once. It's not that simple. So you need customized care. You need a coach, like I told you in the masterclass. You need coaching. You need to be coachable. You need to be able to trust that person, that provider who knows how to guide you through the process. And then you need retesting, yes, and recustomizing of care. So, okay. So, and I'm going to be sharing this a lot more in the next masterclass, a lot more about this come fall, but I did want to just give you a kind of a review on that because it's so important. Hopefully this gets you excited for the next masterclass, and you'll stay tuned for those dates when we get them settled and announced. All right. And I want to ask this question because not because I'm making fun of the person who asked it, but I think it's a good question. Will an endocrinologist order answer for that, where I would say, hell no, heck no, the endocrinologist will not get all these tests. I'm not going to say that. What I am going to say is I have heard way too many times that, when someone has gone to the endocrinologist, that they don't get all these tests. They refuse. I've heard patients tell me that their endocrinologists have said to them, if I don't know what this test means, you don't need it. Or they've said things like, uh, those tests won't do you any good because we can't really treat that anyway. Ladies, that's more than a cop-out. It's a clear indication that many of these doctors, they don't know what they don't know. And if they did know what to do with these tests, they would be ordering them for you. Trust me on that. They would order them. I mean, most doctors are there. They really do want to help you, but when what you're asking doesn't fit within their black box of tools that they have and their way of doing things, they're not going to do it that way. And you're not going to convince them to do it. Some here or there that you might have found that will order a lot of these tests, but again, do they know what to do with it? So you've got to follow the blueprint. You got to have a comprehensive diagnosis after you get these tests. You got to have a customized plan that you're committed to, and that you're fully ready to implement. After we talk, we would talk. Now, my schedule is closed until the next masterclass, but I usually am able to open spots to discuss this after getting some comprehensive testing on your part to be able to figure that out. Okay. All right. I going to need to end it because the connection is really bad. But I did want to answer this question from the group earlier, and does water matter? Water does matter. Your source of water matters a lot. There's a lot of toxins in water. And so you need to really fix your water, drink it distilled or highly purified, reverse osmosis water. There was another question that was asked. Has Dr. Ed had success treating patients diagnosed with autonomic dysfunction? I'm confused about whether autonomic dysfunction is just another way to label a group of symptoms with a missed root cause, or if it is something else. And autonomic dysfunction generally means there is something wrong with the adrenal glands. It's tricky, and it has to do with thyroid issues, almost always. It has almost always to do with blood sugar issues. So adrenal dysfunction is difficult, and I to be quite honest, it's been hit or miss. Okay, maybe 50%. I'm about 50% successful with that, just to be perfectly honest. It's really when your function is very, very bad. Adrenal function is really, really poor. So, and then one final question. Can you use PAM in your cooking versus oil? Do not use PAM. That is poison, okay? Use olive oil, extra virgin olive oil, cold pressed, minimally processed. Next choice would be avocado oil. Next choice, and that's from California or Mexico only. Otherwise, it's usually tainted with other oils, so don't use anything but. The other next choice would be some coconut oil. Okay. All right. There you have it, ladies. Thanks for joining me tonight. Like I said, the connection's kind of off and on, but I'm so glad I got to connect with you on our little camping trip. And uh, hopefully you can get out this summer and enjoy nature like I enjoy so much, and um, do some grounding and be out in the pines and get that fresh, clean, oxygenated air, and enjoy the rest of your week. And I will see you soon. Remember, there are answers. Please have hope, and you still have the ability and the power to heal. Take care, ladies. Have a great evening.